If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Welcome to Rockingham County 411. You're in a good place. I'm Mabel Scott, your Public Information Officer, and today I'd like to introduce again Katrina Wright, who is the Public Information Officer with Public Health, and she's also the Health Education Program Manager. Katrina.
Thank you, Mabel, and thank you all for having us here today. I'm excited on behalf of the Division of Public Health to introduce our new health director. His name is Trey Wright, and Trey has served as a leader in public health administration in several capacities throughout North Carolina for over 7 years, initially starting as in the field of health education. And so he has a great wealth of information, experience, not only in administration, but as well as working on the local level with the communities, partnerships. So he's seen every asset that you could probably see in public health, even with a little bit of experience when it comes to environmental health issues. So we're so happy to have Trey here and so lucky to have such a person of his caliber and experience and just general kindness and knowledge here with us. Prior to joining Rockingham County Department of Health and Human Services, Trey served as the Deputy Health Director for Nash County Health Department. At Nash County, Wright's role, or Trey, as he referred to be called, by the way, role was to provide oversight for health promotion, animal control, case management, and served as the agency's public information officer and accreditation coordinator. So as you can see, Trey has a major volume of just wealth of knowledge. Wright also serves as the awards chair for the Eastern District North Carolina Public Health Association and task force member for the Health ENC Community Health Assessment Survey Design Group, which served as a think tank for the entire community health assessment process, where we are now, how we would be moving in the future, and how it would better serve the communities which every 100 counties in North Carolina have to, health departments have to conduct a community health assessment. So he served on a vital role in trying to streamline that and make it more efficient for our health departments. As I mentioned before, Trey has been a loyal supporter of public health and health education, serving in various leadership roles such as the Society of Public Health Education, which we call SOPHE, and additionally the North Carolina Public Health Association, which we refer to as NCPHA, as well as other professional organizations. So please join us in welcoming Mr. Trey Wright as the new leader and health director for Rockingham County Division of Public Health. Welcome, Trey.
Thank you. I'm very happy to be here.
Yeah.
Well, we're glad and thankful for Katrina for giving us a real good overview of your background. Welcome to Rockingham County government.
Thank you. I'm very ecstatic to be here.
Well, tell us, how did you get into public health?
So many years ago, I was in college and I originally was looking at dentistry. And I remember having walked down one of the halls there at East Carolina in the Brewster building and saw a wonderful flyer that says, have you looked at medical school, dental school? Have you thought about, then it was called pre-health professions, now it's called public health studies. And I looked at it and I was intrigued. It had that same biology type major, but more health professional classes where you interact, you get a better feel for the health promotion. And I enjoyed it, and throughout school and graduate studies, I still was looking at dental, and I went for my master's in public health and dual in communication. And Ironically, we had a health director. He was from the Northeast, named Jerry Parks, and he came and spoke to our graduate class, and I fell in love with it. I was fascinated, and the things that we could do to help our communities. And ironically, here we are now. He was actually my first health director as well, and he's been a mentor and a father figure to me in public health. And he started a motto, and I added to it, that we're in the business of helping people, but we're also in the business of helping one another through our partnerships and all the great agencies that public health currently works with, and the ones we can work with in the future.
Okay, so how do you think your education and your experiences in the past all help to get you prepared to be public health director here in Rockingham County?
I have been truly blessed with where I've been and where I am now. From even my first job as a health educator in a 8-county health department, and when I've been at the coast, I can say honestly, I have been in some of the richest counties in North Carolina, and unfortunately some of the poorest. Whether it had been in our Carteret, Currituck, or Bertie counties, I've been able to see a wealth of interactions and agencies and how partnerships could work with the affluent areas and the poor areas. And with that, I try to bring that knowledge and experience, that how can I help my community from some of these things. And unfortunately, public health has not always been a visible force. Sometimes we think about public health when there's a problem, whether it be an outbreak, a pandemic, but public health is a vital force in all our lives. Public health is with us from life to death, and even before, when we think about our prenatal care, and unfortunately with death and the death certificates in our vital records.
Yes, you're right. So, vision for public health. Share that with us.
Public health, when I see our public health, I see this vision of everyone understands the importance of all aspects of our health. I think a lot into our social determinants of health, where we live, work, play, and pray has a very big impact on how I develop, how I grow, and how I leave this world. Social determinants, if I am in an area that has no farmer's market, low access to healthy foods, that's going to impact my behaviors on a daily, in a day, and in a lifetime, and my children too, and also that community. So that knowledge that these things influence our lives, those social determinants, it's my vision that more people are aware of that.
And I'm glad you mentioned that, because when you say food deserts, I think sometimes some people go, oh, there's lots of food. Okay. Are people able to get to the food? Do people have the money to buy the food? What types of food are easily accessible? Things that we really don't need, or the vegetables, the fruits, the fresh fruits and vegetables?
And where we have our food deserts, we also have our food swamps that are saturated in lower nutritious foods.
Okay.
Some of our foods that are unfortunately are fast foods and foods stocked full of preservatives. So while we have deserts, we also can have the reversal of that swamp, of that saturation of.
I love that.
So that's something I think about too. And there's a lot of studies coming out that these food swamps, as I say, you'll notice there's trends that not only we're talking about the foods, but you'll see, unfortunately, things that target lower income. It might be more dollar type stores that have more preservatives in foods, lack of the grocery store. And also, too, there's more saying that some of the tobacco shops target in certain areas as well.
You're exactly
about
right.
that.
You're right. You're right. What about COVID-19? What more can we do to help to educate and let people know this is a serious matter?
First and foremost, our health education promotion division and all our staff have been doing a phenomenal job with the education information that we've been putting out. Just on my way to work, every day I see one of our 3 billboards that I know are in the county. And with that unified message that we see not only here in the county with our 3 W's, the wear, wait, wash, but across the whole state, this unified message is amazing. I see our social media infographics and things that are put out. I know that there's radio ads playing. Everyone's doing a phenomenal job, but we will still have to strive and continue to do this as we continue through this pandemic to know the important things of our social distance, our mask wearing, and our washing our hands. So just continue the great job and the great work that we're doing now.
All right. And along with the COVID-19 pandemic, we also have the opioids epidemic.
Sadly, substance abuse doesn't take a day off during the pandemic. And like COVID-19, the opioid epidemic, it doesn't discriminate based on race, ethnicity, gender, religion. That anyone can be a victim of substance abuse. And one of the things that's very important is helping the folks that may be at risk for overdose. With children, how to lock up medicines appropriately so they don't get into the wrong hands. If someone does have an overdose, how can we educate and help that individual? The post-overdose response teams, how can they work with that individual that may want assistance, and what kind of services can they be linked to? Because I personally believe no one wants to be addicted to any type of substance abuse or substance or opioids. So. Again, that and COVID, they're not taking days off, so I don't get to either.
I know it. We have to keep on pushing. So along those lines, how do we help more and more of our customers to understand the importance of what you all call healthy lifestyles? How if we do what we're supposed to do ahead of time, then that's going to help us in the long run. And also prevention.
When we think about, and I relate it to COVID-19, when we hear of underlying health conditions, a lot of times I think about what are these small things that I can do to better my health, lifestyle, and behavior. But just the education and the little things and access to things. I know we have our beautiful walking trail. I myself am a cycler. So how can we make this more attractive, per se, to those that may not have done this? And unfortunately, that healthy lifestyle is something that rents do every day. You have to continue at it. It's not something that you magically overnight, but a lifetime of these activities and behaviors goes a very long way. But it's hard and scary to start some of these things at times. I myself, prior to the pandemic, would go to the gym every morning at 4:30. Not everybody can do that, and right now I cannot do that, but it takes a lot of work to do some of those things.
Now that's what
and a
I
lack
call,
of sleep.
That's discipline.
Yep.
But it pays off.
Yep. And now, due to the pandemic, I just do the cycling on my bicycle trainer at 4:30 in the morning now instead.
That's good. But we all need some type of regular exercise to keep us going and to keep off all of those extra pounds.
And little things can help. Taking the stairs, even though it's just a short walk, that pays off in the long run. And I'm a big fan of technology, our wearable technology.
Of course.
But it's always interesting to see how many steps have I done in the day. The American Heart Association recommends those 10,000 steps a day. So it's joyful to see people say, oh, I need to go get steps in this hour, or I didn't get my steps in, so I'm going to walk around the neighborhood today. And some of those things, they're interactive and they're fun, and it's great to see more people wanting to do some of those things.
And I learned some little things where if I go up and down steps, that helps me with my numbers. As opposed to just walking. So let's say it's December 2021. What do you hope we can sit down here and talk to folks on Rockingham County 411 with Roy Sawyer's videotaping us? What do you hope you can say about public health?
When I close my eyes and I think about public health in December 2021, the first thing I think about is every year there's buzzwords, and this year, public health, I can look, whether it be in our local newspaper, whether it be on social media, the word public health is said a lot. A dream of public health being known, it's happening. And I don't want the word to go away. When our pandemic is over, I still want public health people to know and think about public health. It's joyous to hear people now start talking about these things. So in 2021, I want to know that public health, people are still hopefully not talking about a pandemic, but public health.
Yes.
And how they can do certain things, find those nutritious foods, think about taking the stairs. So that's my thing, that public health is not just a buzzword, but it's now a word that we know for the rest of our lives.
And that we will understand that we need to become a little bit more disciplined like you. 4:30 every
It's
morning.
tough.
That's great. That is
tough.
wonderful.
And my wife does it as well. Ask me in July after our child, and that may be a different time. So we'll see.
Well, congratulations again. We are so thankful that you're here with us. This is Trey Wright, our brand new public health director. And folks who watch Rockingham County 411, you know we always give you updates about COVID. So we'll be talking with Fred periodically to look and to hear from him what's going on in Rockingham County, what the numbers are, the stats, the facts, everything that your people put together in that infographic. And we appreciate how you're going to be sharing and making the information easier for all of us to understand.
Thank you.
Congratulations again. Welcome to Rockingham County. You're in a good place.
Thank you so much.